excellent and very helpful. So after hearing a little bit about church teaching on end of life and Father Mike's great reflection, I want to introduce Margie Halsell. She can explain more about what she does in her line of work, but she's going to be talking about finding good care and all that entails.
Thank you, Mom. All right, now we're going to talk a little bit about the how-to, like Father Mike was talking about when this comes about and you need care. Is there anybody here that's involved in caregiving right now? On a personal level? No one at all?
Not
you are?
your husband, wife. He's my caregiver.
Okay. Well, I mean, maybe professionally. Molly, how are these slides going to work? Okay, thank you. So first, I think we're going to talk about finding good care. And so the way to find it is, I guess the best way to start is through the grapevine. Talk to other people who you know, your neighbors, people at church that have had to find care. There's an excellent resource out. It's the Senior Resource Directory. Are you familiar with that? Sandy is? Yes. It's an excellent resource where it comes to us through the Area Agency on Aging. Chuck's going to hold it up for me. And it's an excellent resource for you to find the home health care, the county programs that are available. But let's talk about what does good care look like. And I think we've already talked about the concepts of advanced care planning, but these are objectives and then taking action with your personal care plan. So what does good care look like? So for good care, we want to really address the whole person, don't we? Not just the physical bathing and dressing and, helping to get to the toilet. But we also want to, aren't things important like at 1 o'clock every day he has a glass of grapefruit juice with 4 pieces of ice in it? Or at 6:30 every day she listens to the rosary with Mother Angelica. Those things are important. And the only way that we're going to get that is that the caregivers know lots of details about you or about the person that they're giving care to. And you can impart that by giving them their history. What did they do as an occupation? What were their hobbies? How is their faith important to them? And in what ways, and what things are important to have in the room with them? So good care can start by interviewing the agency, finding out, how they gather their care staff. Do they do background checks? Do they do fingerprinting? Do they get the health screening? If you hire from a neighbor who knows somebody, you're the employer and you have responsibilities. If you hire privately like that, you are responsible for workers' compensation if they get hurt in your home. You are responsible for payroll taxes, and the nicest person on earth may turn around and say, you know what, come to think of it, you paid me all that money over all those years, and now I really want my Social Security and my taxes paid on it, and that's going to not be a fun experience. And you don't want that when you're in the throes of caring for someone. So I recommend that you go through an agency or take the responsibility on being an employer for them. So these are the questions that you can ask. How do you address the spiritual aspect of caring for my husband? How are you going to, how does your staff take care of him emotionally? It's good to have a clean person, the cleanliness, but you also want them to feel that's part of the dignity, is that their emotional and spiritual needs are addressed, and they're social. Maybe they have a real sense of humor, so it's good to keep humor around them. And so, alrighty, and so you really are that advocate. Every little tidbit you can give them about your loved one is what's going to ensure that care, that good care that you're looking for. Alrighty. So physicians who have had additional training, that's a tough one. Does anybody know one about having good conversations? Physicians are just like us. Discussions about end of life are hard for them, just as hard as they are for us. And I think there's a lot of physicians that are just by experience having to have these conversations. So, but help your physician if they're uncomfortable to say that I really need to talk about this. So you can be of help to your physician. A team of caregivers that focus on all aspects. You'll find that in palliative care and you'll find that in hospice. We're going to talk about that. But a team of caregivers really helps to bring in all those aspects of the care that we just talked about. Respect for decisions that are made. Sometimes that's hard, but we have to respect the decisions of that person that they've either verbally conveyed to you or they've written out in their advance directive. And I guess it's hard for us to talk about every single aspect of what could happen to you and for your loved one to know. Part of preparing is having those conversations. And I know our son was in a terrible motorcycle accident back in November. And there were lots of decisions that needed to be made. His hand was crushed, and it looked like his pinky and maybe the second finger was going to be amputated. But there's lots of us in the family, and there's my son happens to be a surfer, and there's two other surfers in the families, and they spoke up and said, leave the pinky on, because he needs it to paddle out for the waves. And even if it was going to flop around, Charlie has such a great sense of humor that he could get a lot of mileage out of a floppy little finger. So they said, please leave it on until, well, now he has you can't tell. He can't bend it, but you can't tell, so he can definitely paddle out when he can start surfing again. So it was nice to have the surfers in the family there to make that decision. Okay, we say we care. Don't we all care here? How many of you care? I do too. But I'm a bit of a contradiction because I haven't, years ago I prepared an advance directive and it's been lost in a couple of moves. And so I haven't prepared another one. So I say that I care, but I haven't prepared another one. And after Charlie's accident, we vowed as a family, let's have an evening. I printed out all the advance directives and some of the Catholic teachings on end of life, and we never had that meeting. So, so here's some statistics from the Conversation Project. It's a wonderful resource for all of us. But look at this slide. It says 90% of people think it's important to talk about wishes for treatment and care through the end of life, but only 27% actually speak with a loved one about their wishes for treatment and care. So a lot of us are in that same boat. We really say that we care, but we don't follow through with it. 82% of people say it's important to put their wishes for treatment and care in writing, but only 23% have actually done that. And then 80% of people say that if seriously ill, they would want to speak with their doctor about their wishes, but only 7% have done that. So we're a bit of a contradiction there. And one of the ways that we can help each other is maybe just push each other to get that filled out. And like I said, I don't know that you can have all the conversations, but I have a sample of that conversation kit in the back, or project, and it is just wonderful. It really helps you out in at least getting an idea of what's important to you so that your loved one can make a decision for you. Okay. So advanced care planning is really all about having a conversation, is really talking about it, because you can fill out the paper and you can put it in a drawer or put it in your file cabinet, and if you've never talked about it, and say you've named an agent, maybe your attorney, who doesn't really know you that well, that's not going to help them very much with end-of-life decisions. Alrighty, so an advance directive, how many of you heard of that term before? How many of you have one? Okay, so a lot of you do have one. So an advance directive is exactly that. It's directives that you've written out in advance that you want you've named an agent, and you want that agent to carry out for you. Like, for instance, most of them say no heroic measures. And if the burdens outweigh the benefits of the treatments, to please, make that decision to stop the treatment. So it's a written document. It explains what type of care you want or wouldn't want. Yes, ma'am.
I just want to make a comment because some of it sounds like it's pre-scripted. And so when you do fill it out, you can cross off and add and customize it totally. So
Absolutely.
So it might be a little intimidating, but it doesn't have to be.
It doesn't have to be. So I've got a couple samples in the back for you, and you can just Google on the computer Advanced Directive, California Advanced Directive, and you can find several different styles and copies. I have a sample back there also of you.
We brought some from the Archdiocese as well.
Oh, good. So Molly's brought some from the Archdiocese. And I also brought you 4 pages of an advanced directive that I just saw for a lady that moved in one of our care homes. And she had specific directives about her Catholic faith and what that means to her and what she wants to be around her, that she wants deacons or priests or nuns, that she was very active in her parish and that she wanted to continue that even if it appeared that it didn't have meaning for her anymore. And so I brought a few samples of that to show you because it's very specific about her Catholic faith. So I think it would be helpful. And, like you said, what is your name?
Celine.
Celine? Okay, like Celine said, you can alter them. You need to initial it, that you altered it, because then there's going to be a question, or you could retype it would be the best thing, because if there's anyone that would question your document, then you've got some problems. But be sure and initial it, maybe even put the date on it, that you altered it. Okay, durable power of attorney for healthcare and living will. I think most people are using the durable power of attorney for healthcare. Is that correct?
Yes.
It's a part of your trust. And so living will is a little bit, I think that was one of the first documents that came out. But the advanced directive is much more used widely. So the advanced directive only takes place when you can't speak for yourself. So that's something you need to remember. As long as you can speak for yourself, the healthcare team is going to come directly to you. And okay, let's go on. Okay, what they are, they're a communication tool. So for assisting you to clarify your wishes and what kind of treatment you would or wouldn't want. And what they're not prescriptions, and they're not plans of care, and they are not do not resuscitate orders. Many people assume that because they put no heroic measures in their advanced directive, that they have a do not resuscitate. Have any of you thought that? I've got that covered because it's in my advanced directive. Well, it's not. So there's people that come into our care homes. We have 2 care homes for elders with memory loss. Well, dementia. It's progressive and it's fatal. And there are people that come in and have an advanced directive, and their family insists that they have a do not resuscitate. That's not the same thing. They're very different. A do not resuscitate order is now the post form. I have them in the back. They're bright, bright pink. And they are signed by a doctor. So it's a doctor's order. So if emergency personnel show up, there's a doctor's order in front of them, and they can carry that out. If it's an advanced directive, they can't. They have to transport you, and in hospital is really where that advanced directive is for. So, okay. Advocacy tool. Okay, we can go on. Okay, here's some additional definitions for you. Palliative care. Has anybody ever heard that term before? Okay. Has anybody ever used palliative care before? Okay. Palliative care differs from hospice. Hospice is where there is a definite diagnosis, a terminal diagnosis. It's usually around 6 months or less is the prognosis. palliative care is a chronic condition, like maybe multiple sclerosis, maybe Huntington's disease. So it's diseases, chronic illnesses that have a lot of discomfort and a lot of symptomatic needs to be managed and to be treated. So palliative care is the whole aim and goal of it is to keep you comfortable and to provide you with the equipment that you need for your family, for the caregivers, for you to be comfortable, for you to be as mobile as you can or comfortable as you can. So palliative care, most home health agencies have them. You can get palliative care in the hospital. So how do you get it? You just ask for it. You just say, tell me about the palliative care and how do I get that? How do I get some of those services? So hospice, we talked about, that focuses on relieving the symptoms through the end of life. I just want to say something quick about hospice. If you have any sort of preconceived notions or attitudes about morphine, about any sort of medications that they hasten death, that they kill you, that please sit down with someone and ask them about that. In particular, a nurse, and in particular, a hospice nurse, because I didn't know. When we opened the care homes, I saw someone who was very, very, he didn't weigh very much at all. You could barely see him under the covers. And so, but he was sweating profusely, and that was the only sign of discomfort. So when I touched his head, I called the hospice and I said, he's just sweating, but he's not in any other signs of distress. And they said, just the fact that his heart is beating and that his blood is circulating is too much for him right now. And it's distress. And so giving a little bit of the morphine, and within minutes, the sweating stopped, and he was very, very comfortable. So I'm amazed at the wonderful treatments that are out there to keep you comfortable and very comfortable. So the pulse, like I said, it's a doctor's order, and so emergency teams can. Did you have a question?
Well, I was going to say, as far as hospice, when we were up in Oregon for my mother-in-law, it was explained to us that you can request hospice if the doctor would not be surprised if the patient passes away in 6 months. And if the person doesn't, you can renew the hospice.
Yes.
And renew it again.
Yes.
If the patient is still there. So it's not a time limit.
No, there isn't. There's not like well, your 6 months is up, buddy. You're off. You're off of hospice. No, they will what they call recertify you. So there's certain Medicare guidelines. It's your Medicare is switched over, your insurance is switched over to hospice, and then they do all the ordering of prescriptions and medical equipment, and you can recertify. And we had a lady on and off hospice for 5 years, and so it was amazing. So she would go off for a few months and then back on, because there was very strict guidelines to be recertified. So. Okay, so that's a good point, that it's not, you're kicked off after 6 months. So, okay, non-hospice, so palliative care, we already talked about it. Just speak up and ask for it. Ask your hospital, ask home health agency, ask your doctor. Hospice, this slide is telling you about how the reimbursement works. And then non-profit hospices take you on regardless of insurance, whether you have it or not. So they're funded through private grants, through government grants, so you don't need to worry about that. So, okay, how do you complete an advance directive? So first of all, you identify a surrogate or an agent, someone that you want to speak for you in the case that you couldn't speak for yourself. And so that could be a loved one, it could be a neighbor, it could be a friend. Then think about your treatment wishes and your values and your goals for care. Some of the guidelines say, is it important for me to die at home? Or do I mind dying in a facility, a care home or a hospital? Some of them will ask, questions they'll ask you to prompt you. Is it important that I can communicate? and or not. And so, I don't know, I find these hard to struggle with because, I don't know, we have people that can't communicate, their lives are very meaningful. And in my own life, I've come to a time where I really appreciate that our lives are not meant for us, they're meant for others. And so I really struggle with all these questions. And I think, like Father Mike pointed out, what's reasonable is important. It's not a burden, but many of our people, their lives are very meaningful in ways that I'm sure before they contracted dementia, they never dreamed possible. So, okay, write down your wishes in the advance directive. So that's important. Most of them leave you a space to write down some things that are added. Most of them are check boxes, and then you can write down some additional information. Have 2 people witness or have a notary sign it. So 2 people witnessing it, they don't even have to know you. You just have to produce a picture ID. Many times we get an advance directive and we say we're going to fill this out, and we put it on the kitchen counter, and then maybe we get some jelly on it, or we spill some coffee. So we wipe it off as best we can, and then we put it in a drawer. And then it's there for 3 months or 6 months, and then we throw it away when we clean out that drawer. So the main thing is get it filled out and have it witnessed. Your neighbor can, anybody that knows that you are that person that's signing that can be the witness. Talk to your loved ones, caregivers, and physicians about your choices so that they know. Okay? Who can't be a witness? So a patient's healthcare provider or employees of a patient's healthcare provider, operator or employee of a community care facility, the agent that's named in the advance directive cannot be the witness. One of the witnesses cannot be related to a patient by blood, marriage, or adoption, or one of them cannot be entitled to a portion of the patient's estate. So those kind of all make sense. So the conversation project, this is the most wonderful thing. People came together to really put something simple, really helpful, so that we can get these things filled out and have meaningful conversations. So I have a sample of it in the back. It's pretty hefty, so I didn't print it out. But I also left this little green book in the back. And if you really would like that and you don't have the means to print that out and access it, I will print it out for you and send it to you. So leave me your name and phone number and tell me what you want. You know, an advance directive or the conversation project. It's a whole starter kit. And it's for pediatrics, it's for elders. Excuse me. So here's some of the ways that you can start the conversation. Just I need your help with something to get the conversation started with your family. Remember how someone in the family died? Was it a good death or a hard death? And how will yours be different? So those are some good things to think about that I think we waited too long to use medication. When my brother died, he was very cautious and wanted minimal medication. And I actually have to say that it was good for him. It was the right decision for him. So I was thinking about what happened to so-and-so, and it made me realize that we really need to have this conversation, or that same thing could happen to us. Who needs an advance directive? Does anybody know? Pardon me?
No, I thought you just had.
Oh, so who needs one?
We all should.
We all should. But how old?
18.
18 years or older. Because at 18, your parents can't make those decisions unless you've made somebody an agent. So isn't that interesting? Okay. Even though I'm okay right now, I'm worried that whatever, and that I want to be prepared for that. That, maybe there's a car accident, maybe there's a sudden illness, and I want to be prepared. I need to think about the future. Will you help me? So these are some really easy, nice ways. maybe you don't need this. Maybe you're a close family, or you can just say, hey, we got to talk about something, and just start talking about it. But I just answered some questions about how I wanted to end how I want the end of my life to be. I want you to see my answers, and I'm wondering what your answers might be. So those are some good, helpful ways that you talk about. In the Conversation Project, they actually have a scale that's from 1 to 5, and it says, I want to die at home, or it's okay with me to die in a facility, and where do you rate in that? And how strong are your feelings? So I think that's a wonderful way to show your family that you have strong feelings or you don't. Okay, my gift of grace. What activities make you lose track of time? In order to provide you with the best care possible, what 3 non-medical facts should your doctor know about you? So these, again, are wonderful things for us to think about, just to spur on the conversation and to make us think about things that we don't normally think about. These are hard. It's tough to talk about that. I'd like to show you really quickly in the Conversation Project, they actually have a letter that someone wrote. And it says, don't panic, it's okay. I'm just going to read you the very last paragraph. It says, if you're faced with a snap decision, don't panic. Choose comfort. Choose, I don't know what that says. Oh, choose home. Choose less intervention. Choose to be together at my side, holding my hand, singing, laughing, loving, just reminiscing and carrying on. And I will keep loving you and walking with you and being proud of you. And so this letter is quite a bit longer than that, but it gives you, it's just a wonderful way to say, please don't worry. And even if you maybe are making a decision that maybe it goes against something we talk about, but now that you have this situation faced in front of you, you know it's the right one to make, then it's okay to do that. And so, here's that little scale in the Conversation Project where it's 1 to 5. And so I also left you in the back some of these Vial of Life. Are some of you familiar with these? So this is a wonderful aid for you to put on your refrigerator. It has a magnet. The reason why it's called vial, it used to be a vial, a medicine vial. And you put your medical information in it, and then you put it in the fridge. Well, the medical responders were having to dig behind the mustard and the mayonnaise and last night's leftover meatloaf to find this vial. And San Diego is the ones that came up with the Vial of Life in a plastic container that is on a magnet on the front of your fridge. So in it, it's important information for emergency responders. When you're in an emergency situation, a lot of your cognitive ability just shuts down because your loved one is struggling and you just want someone to save them now, help them now. So it gives you your height and weight. Don't put FAT or none of your business. Put your weight, because some medicines are delivered by your weight, according to your weight and your height. So put that in there. And it says, do you have a do not resuscitate or an advance directive? And where are they located? So describe it in there. It's in the drawer, the left-hand drawer next to the dishwasher. And so be sure you don't put Taco Bell hot sauce on top of it or things like that. Just have that ready for them to access. Because in time of emergency, when my mom had a stroke, I was listening to the doctor. He was telling us. And all I could see was his mouth going like that. And I just said, so fix it. So, that was my response. And so just don't underestimate how much, seeing your loved one in distress can put you under duress and you can't answer questions that you know very well. So thank you very much. Thank you.
Thank you, Margie, very much. And so I think we're going to take a break just for a little bit, and then when we return, Father Tamayan is going to be talking about pastoral care at the end of life, and then if you can save your questions for the end, we'll just have all three, Father Mike, Margie, and Father Tamayan, just be able to answer any questions you might have. All right, so let's take a break and come back in 10 minutes.